Do you experience excruciating period pains that interfere with your daily life? In this video, I will share with you everything you need to know about period pain and how to reduce your pain and get your life back. For the best hormone healing and fertility advice, make sure you subscribe to the channel clicking that bell icon so that you don't miss a video I post every Thursday. Also, join our Instagram dedicated for women just like you, heal their hormones and boost their fertility. Remember, this is not medical advice, so be sure to seek a provider that knows your unique situation. With that being said, these tips have helped hundreds of women that I've worked with over the past 8 years. Now it's your turn. First off, I want to reiterate that periods are normal, but period pain is not. Period pain is also known as dysmenorrhea, so if I refer to it as dysmenorrhea, I'm just talking about period pain. There are two different types of dysmenorrhea. One of them is primary dysmenorrhea and the other one's secondary dysmenorrhea, and they're very different, so the treatment of them will also be different. Some symptoms of dysmenorrhea include nausea, vomiting, and even fainting spells. Like, I always remember my mom would tell me stories of how bad her pain would get, that she would get pale and fainty and had to leave school or even work. So a common cause of primary dysmenorrhea is prostaglandins, and these are just chemicals that encourage your uterine contraction. This uterine contraction, so your uterus contracting, is what causes that pain. You know it's primary dysmenorrhea because you've probably had it from the very beginning and you only have it during your period. So if your type of period pain is primary dysmenorrhea, you've had it from the very beginning of your period when you first started menstruating, and you only have that pain while your period is, like, the duration of your period. If you have it before or like throughout the month or after, it means it's likely secondary dysmenorrhea. Secondary dysmenorrhea is period pain caused by pelvic abnormalities. So it's not caused by the prostaglandins like primary dysmenorrhea does. It's caused by something abnormal in your pelvic region. So that could be in your ovaries, your uterus, fallopian tube. And like I just mentioned, in secondary dysmenorrhea, you will experience pain not just during your period, although you will have pain during your period. You will also experience it before or after or even at ovulation. Common causes of secondary dysmenorrhea includes endometriosis or adenomyosis, also pelvic inflammatory disease, also known as PID, and ovarian cysts. Many times in secondary dysmenorrhea, there will be some type of family history. Secondary dysmenorrhea also usually starts in your 20s, so not from the very beginning. It usually starts later on in your menstruating life. So in this video, we will focus on primary dysmenorrhea specifically and treating that type of pain. For period pain relief, you want to focus on reducing inflammation and reducing the prostaglandins that are the ones causing that period pain. And instead of recommending ibuprofen or aspirin or other NSAIDs, I like to focus and recommend natural healing supplements. If you suffer from period pain and want to share them with the women that watch this video, leave them in the comments below. Going back to plant-based period pain support, I like to use Semaine, and it is a plant-based supplement that helps with period pain. It is made with the highest quality bioavailable ingredients that support your body and help you have a better period. It is made with the highest quality bioavailable ingredients that support your body and help you have better periods. They are also drug-free and are free of synthetic fillers, so they're completely plant-based. They help improve period pain by helping reduce inflammation, which is what is causing this pain in the first place, together with the prostaglandins encouraging that contraction. That is what causes the inflammation. So by helping reduce inflammation, that is how your period pain reduces as well. So if you want to know a little bit more about the ingredients, my favorite is ashwagandha. It also has boswellia. It has vitamin D. It has green tea, curcumin, magnesium, quercetin, and resveratrol. And these are all well-known nutrients that help with reducing inflammation. Samane helps improve period pain. It also helps improve bloating, and it helps improve your moods during your period. You start by taking them a few days before your period so that your body kind of starts to build some reserves and it's already in your bloodstream. So when your period starts, you already have a head start. And then you also take it throughout your period time. Finally, remember, period pain is not normal. So if you're experiencing period pain, honor your body, take some rest, slow down, maybe take some anti-inflammatory supplements like Samane, also anti-inflammatory diet, reducing sugars and anything else that you feel causes inflammation like alcohol, and making sure you do some movement if you're having a lot of pain, trying some stretching or some yoga just so that your body is not under so much inflammation. You can find more about Samane using the link below too, and if you have any questions about them, make sure you let me know in the comments and I'll be happy to answer them for you. Remember, the information here is for educational purposes only, so make sure you talk to your practitioner. They know your medical history the best, they know your family history, and this information will never replace that interaction with someone that can help your unique situation. Now you know how to reduce period pain. If you want to know more about hormone-friendly supporting supplements, make sure you get my free guide in the link below. Again, join our community of women just like you over on Instagram, or join us over on Facebook at our Hormone Healing Female Collective, where I share my most valuable content and where you get priority with all of my programs and offers. Again, as always, if you like this video, make sure you give it a thumbs up, and don't forget to subscribe, comment, and share it with women that you know will benefit from it.